fourth among countries with tuberculosis infection globally. To discuss the collaboration between the United States and Nigeria on the efforts being made to reduce the prevalence of tuberculosis, we have in the studio an international health specialist with vast experience in international development and public health programs. She's also the head Tuberculosis and Resource Mobilization for USAID Nigeria, Ms. Minal Àmín. Welcome to the Radio Nigeria, Ms. Àmín.
Thank you for having me today.
Okay, so we're talking tuberculosis, and I really want to know a lot about this. What is the level of collaboration between our country, Nigeria, and the United States?
The United States, and especially USAID, has been partnering with the government of Nigeria in its fight against TB. We have a shared goal of reducing TB-related deaths and illness in this country. Since 2003, USAID has prioritized Nigeria for its global TB control efforts, and in fact invested over $100 million towards the country's battle against TB. We at USAID are extremely proud of this partnership, and we support the National TB Program in accelerating and intensifying all efforts to reduce the spread of TB, especially by finding and treating the over 300,000 missing cases, as we say. Those TB cases, those Nigerians who have gone undiagnosed and are currently not being reported.
So what would you say has been your assessment following this collaboration that you're talking about?
USAID's approach in Nigeria very much complements the priorities of the government as well as our development and technical partners. Through our various implementing partners such as the Challenge TB activity, USAID is ensuring access to good quality patient-centered TB prevention, diagnosis, and treatment services for Nigerians throughout the country. We strongly believe that Nigerians should always have access to life-saving services. Our programs are ensuring that those affected by TB receive prompt diagnosis, enroll in treatment, and most importantly, successfully complete their treatment. Over the years, thousands of Nigerians have benefited from USAID support as well as the support of the entire U.S. government, from new testing sites to new TB treatment centers with trained healthcare workers and community-level public awareness campaign. In fact, campaigns in which we have done radio segments similar to this one in which we are trying to increase awareness about TB.
So talking about TB, what are the symptoms of tuberculosis? When one has tuberculosis, how does one know that, wow, this is tuberculosis, what do I do now? Let's move forward.
Sure. In simplest terms, TB is a disease that is spread from one person to another via germs. Essentially, it can be spread at the workplace, in the home, in the community, anywhere where people are in close settings to one another. The most common symptoms of tuberculosis are fever, weight loss, prolonged coughing, so coughing for more than 2 or 3 weeks, sweating at night. The good news is that TB is 100% curable. So if anyone has signs or symptoms of TB, they should go get tested, they should find out if it in fact is TB, and then they should initiate treatment. We
wish the ranking of Nigeria was a bit lower than what it is now. What is really the input of USAID, in trying to help Nigeria really, to improve its present ranking on tuberculosis?
Well, one thing we're doing this week collectively is commemorating World TB Day, which is annually regarded on March 24th. And though this is an annual event, we are working hard, very hard, to curb the TB epidemic in Nigeria 365 days a year. So this year's theme for World TB Day is Wanted, Leaders for a TB-Free World, and Nigeria has adopted that slogan, so Leaders for a TB-Free Nigeria, and the focus is to build commitment to end TB at all levels, from national to state to local government area, from heads of states to parliamentarians, governors, community members, doctors, patients, you name it. USAID and its partners are working to identify leaders at all levels to raise awareness on this important issue, to take action and advance the country's effort. The U.S. government is very committed to this partnership with the government of Nigeria, and we're fully committed to supporting efforts to eradicate TB in Nigeria.
Radio Nigeria Network Service takes the message all the way to the grassroots, in their cars, in their farms, and everywhere. Talk to Nigerians now. How do we achieve a TB-free Nigeria? Exactly.
What I would suggest is, if you yourself have symptoms of TB, night sweats, fever, prolonged cough, or you know someone who has these symptoms, we urge you to go get tested. There are over 4,000 government-run health centers and clinics in this country that provide free testing and free treatment. And so the best you can do really is to go get tested and initiate treatment. In fact, if you have tuberculosis, and then spread the word. Tell other Nigerians this is not a scary disease. It should not be a scary disease. It is 100% curable. That is my message.
Ms. Minal Àmín, Group Head for Tuberculosis and Domestic Resource Mobilization for USAID Nigeria, thank you for speaking with us on this day, the World Tuberculosis Day.
Thank you again for having me.